welcome to my channel. This is Dr. Ario here with another session with Health Talk with Dr. Ario. So thank you for tuning in. If you're new to this channel, please don't forget to subscribe and also make some comments because I will reply back to you. And if you are watching on our Facebook page, welcome and thank you for tuning in. So see, this channel is all about you. It's about your health. It's about investing in your health, taking responsibility for your health, because I believe in you. I believe in your health. I believe in keeping well. So I hope that through this talk you are going to learn and gain vital information that will allow you to make informed choices about your health on a daily basis. And guess what? The knowledge you gain here is supported by medical evidence, so you know that you'll be doing the right thing on a day-to-day basis. So hello once again. So what's the topic of today? Well, it's a very serious topic. Yes, we are dealing with the topic of cancer. We are looking specifically at the red flags of cancer. So the sort of worrying symptoms that we should all be aware of and not be ignoring when we see. So why is cancer important to talk about again? Because it's actually the second most common cause of death after heart disease. So after heart attacks, cancer is the other disease that is killing a lot of people. The good thing is that a large proportion of cancers can actually be cured if we pick them up early. Unfortunately, most people miss the signs, they miss the symptoms, and that means that they see their doctor very late. And late diagnosis actually means that by the time they are seen, the disease has already advanced and then nothing can be done, and the chances of cure is minimal. Yeah? So that's why it's really important that we look at this. Now you will learn from this topic that actually there's no one symptom, there's no specific symptom that causes cancer, because there's various types of cancer, okay? And so that's why it's so important that you actually prevent yourself from risk exposure. Now we did a fantastic video on cancer risk, which I have on this page and also on this channel and on the Facebook page. So please do make sure you have a listen so you have a complete picture of the cancer series talks, okay? So the first symptom that we're going to deal with is blood in the stool. Now, they are not in any order of importance. They're all very important for you to be aware of. I just, started with this one. So blood in the stool. Now, you're probably wondering, ooh, I saw blood in my stool the other day. Does that mean I have cancer? It doesn't always mean that you have cancer, because there's so many other reasons which are non-cancerous reasons why someone might have blood in the stool. Things like pile, which are the common reasons why people notice blood in their stool. Piles, or some of you might call it hemorrhoids. Also, when there is certain conditions which affect the bowel that causes inflammation. Actually, inflammation might be too much of a term, but like irritation and swelling of the bowel, that can sometimes cause a bit of bleeding in the wall of the bowel, and that therefore can present as blood in your stool. Also, nowadays all of us are on some form of diet or trying it. So because of that, a change in diet can also even present sometimes as that. People that don't drink enough, so fluid intake can also affect that, because often people that are constipated, it means that they have to strain a lot, and passing hard stools in this sort of fragile bowel can actually cause a bit of rubbing and therefore cause a bit of bleeding. Not only that, it puts pressure on the blood vessels in the bowel, and that's why sometimes hemorrhoid can happen, and therefore people get bleeding in the stool. So if you notice blood in your stool, this might come as blood in the stool itself, or actually just passing blood, okay? So if you notice that, then please do get it checked. But like I said, there might be other reasons why you might have it, and not necessarily because of cancer. But don't ignore it, particularly if it's not going away and you can't explain it, okay? So if you're passing blood in your stool for about 3 weeks or more, and you can't really explain, not because you've been constipated and you treated it, not because you know already that you've got certain bowel conditions that makes you prone to this symptom, but you just haven't it, then you need to get it seen. We are going to deal specifically with bowel cancer at some stage, so I will not go too much over this, okay? The other thing that we need to be aware of is change in bowel habit. Now, most of us, we sort of know our bowel habits like clockwork. So some of us, sometimes I ask patients, they say, oh yeah, I go every morning when I'm reading the newspaper. Yeah, it's normal for them. They go every morning and that's, bang on. And some people will say, every other day or every 3 days before I open my bowel, even a week, and this has been going on for 20 years, 30 years, So you're not worried, you know that. But if this changes, so new diarrhea, new constipation, and it's persistent. So, like I always say, with cancer, it's something that is there and is growing and is changing, okay? Now, you might not see the symptoms. So often, cancer may have even been present for a period of weeks or even months. And, it just takes time for it to be noticed. But you might notice some of the symptoms earlier. That's why it's important not to ignore symptoms when you see it. So if this happens to you, so new diarrhea, new constipation, and you can't explain why, not because, you ate something dodgy, that's why you're having diarrhea, often because if you have a tummy bug, for example, you will have pain, you might have nausea, you might have vomiting with it, you might have a fever, you maybe traveled recently, so you ate something you shouldn't have eaten, and that's why you're having the symptoms. But there's something new that has happened, then please do get it checked, okay? The other thing that you might notice in changing bowel habit is that you feel like you want to go to toilet, all right? Like you want to open your bowel, but when you go, you've opened your bowel, but when after like a few minutes, you still feel like you want to go again. So that feeling of never emptying your bowel, and it's just ongoing, all right? You need to get it seen, all right? Now, bowel cancer is more common in people from age 50 and above, but it doesn't mean that it can't happen in younger people. Because there is certain genes that actually predispose certain people to getting bowel cancer, and often genetic conditions present earlier, okay? But then you might know that because you might have a family history. But like I said, we'll deal with bowel cancer in more detail later on. The third symptom that you should be aware of is persistent cough or coughing up blood. So let's deal with the cough. And I think this one, people are very good on it because we see a lot of people come, doctor, I've been coughing for, 3 weeks, I'm worried. So that's good. And that's because there's been a lot of adverts, a lot of campaign to make people aware, particularly about lung cancer, okay? So most people do present with cough. So we're talking about persistent cough. So anything 3 weeks or more, okay? Like I said, because there's no specific symptom for cancer, it doesn't always mean you have cancer, because often we might have a cold, and even though we know colds are viruses and they naturally run their course, often it will take about a week, 2 weeks, and we are back to normal. But sometimes it can persist a little bit longer, especially if you live in a cold country, the weather changes, and some of us, we expose ourselves when we go out, when we shouldn't, in the cold weather. So that predisposes us to picking up cold after cold. And that can be the reason why you're having a persistent cough. But if you're having a persistent cough, particularly you're a smoker as well, that's a big risk already, right? So you should see. The other reason why that you might have a persistent cough, which doesn't mean you have cancer, could be asthma, which is a type of chronic or long-term lung disease, and that often cough is a big symptom of it, okay? Also, people that smoke might have other lung conditions like COPD, where you get obstruction of the airways, and that can cause them symptoms. But this is they might have other symptoms with it. So, but having said that, you should still see your doctor, yeah? The other reason why you might have a persistent cough is acid coming back on your throat. So people that maybe you have a heartburn already, you normally get indigestion, that might be a clue. You notice that when you lie down, when you eat certain meals, you have your symptoms, that might be because of irritation, acid coming back on your throat all the time, and it might be worth trying some Rennies or trying some anti-acid medicines to see whether that relieves it, and if it's not helping, definitely go and see your doctor, okay? The other symptom I did mention was coughing up blood. Normally we shouldn't cough up blood, okay? Sometimes when we have a chest infection, for example, which might be a simple bacterial infection, because of cough, you get inflammation and irritation in the airway, and therefore sometimes it can present when you're coughing, you bring up a bit of blood. So you might know because it's in the context of that infection, all right? However, if you cough up fresh blood, yeah? So whether it's teeny tiny coughing of blood, okay, or a large amount of blood, you should still see your doctor, all right? Because it could be TB, all right? It could also be a clot in the lung. A clot in the lung can present as that, but often you will be short of breath with it. Not necessarily always, but often you might be short of breath. You might have chest pains with it. alongside. So you definitely should see your doctor anyway, okay? If you cough up blood, don't ignore it. The next symptom is breast lump, okay? So this is more for the women, but also obviously if you're a man and you have a sister or an auntie, a mom, this should be important to you as well. Thankfully, breast lumps don't always mean that you have cancer, okay? It could be due to a cyst, which is a collection of fluid, okay, that might present like a lump. It could be an abscess, which is a collection of infection. So often it might be painful, the skin might go red, you might have a fever alongside with it. So thankfully, most of the time when women actually have a lump, it's not because of cancer, okay? But also it could be because of cancer. So picking it up early would be fantastic, because then we can do something about it, okay? So all breast lumps should be investigated. Now, when you notice a lump in your breast, don't go, oh, I think it's fine, and then you ignore it. Go and see a doctor, because doctors are trained, okay, to know what is an abnormal lump and what is not, because there's certain features they look for when they examine you. But also, even as a doctor, when I examine you and I notice a lump, I might know that it's benign from the examination, but the only way I can really exclude that this is not cancer is actually to refer you so that you can be scanned, okay? And even then, that doesn't end there, because often we have to take a biopsy, because that's the only way you can make diagnosis. To take a sample from the lump and actually look at it under the microscope to see if the features of that lump is suggestive of cancer or not. So, as a doctor, even when you come and see me and I say, there's a lump, I can't say, oh, it's fine. I can say, I feel, that it's not cancerous, but let's have a look at it. So we would also get it investigated, okay? So it's important that you get it checked. And I know in certain countries, there is a breast screening for women. So please don't ignore it when you get your letter to go and get it checked. The other symptom is breast discharge, okay? You should not ignore it. We should not be discharging any form of liquid from the breast, unless obviously you are lactating, so you are breastfeeding, okay? Or you are heavily pregnant, your body is already preparing for breastfeeding, and therefore, you are producing milk. But you shouldn't. The sort of discharge that you should be worried about is bloody discharge, okay? And particularly maybe from one nipple. So bloody discharge either from both nipples, or you're having some form of discharge from just one nipple, okay? Because often, yes, it's often not likely that you will have cancer of the breast in the two breasts at the same time, okay? Often it starts from somewhere and then it spreads to the other. So if you have a unilateral symptom, so one nipple discharging, or you're having a bloody discharge, then you need to get it checked. Don't ignore it. Also, other symptoms that you should be aware of the breast is dimpling in the breast. So you sort of is going in on the skin. You see dimpling on the skin. You've seen people with dimples before. You see how it looks like, okay? So if you notice dimpling on the breast, or you see color change, often it looks a bit like orangey color. If you notice that change, you should please get it checked as well. And that is why it's really important, particularly when it comes to breast cancer, is that women, you do examine yourself. Do that monthly. Okay, normally you can have physiological reasons why your breast might feel a bit lumpy, because usually around the period time, because of hormonal changes, okay, the chemicals in your body that regulate your cycles. Because of that, some women might notice some changes, which is transient, so it doesn't last long. Around the period time, they might notice like enlargement of the breast, or they might feel tenderness of the breast, or feels that the breast feels a bit lumpier than normal. But that obviously often settles after your period. So if those symptoms are not going, or you notice a lump that maybe came around your period time but has still persisted beyond your period, okay, then you need to please get it checked. So if you are used to examining yourself every month, usually do it after your period, okay, when those changes have settled. You will know what is normal for you. So when something stands out, you are easily able to pick it up, okay? All right. As we are dealing with lumps, I thought it would be better to deal with the men as well, okay? So the next thing is testicular lumps, okay? Now, obviously, the testicles of a man looks like lumps anyway, all right? But if you are used to examining yourself or feeling it, you probably know how it feels. You shouldn't feel any hard bits to it, okay? So you might notice, if you notice any sort of painless, so it doesn't feel painful, or it might be slightly uncomfortable. If you notice that sort of lump in the testicle, please do get it checked. If you notice an enlargement of your testicle, please do get it checked. Now, there might be many other reasons why this can happen. If you have an infection, it can cause swelling and a lot of fluid building up around the testicles, so that can cause that. But that, you will notice the changes. You'll feel pain, you might have a redness of your skin, you might have a fever, you know, it will go along with the picture of infection. And even then, you still need to see a doctor to treat it. Also, sometimes we get swelling of the blood veins, okay, around the testicles, and that can present as a lump, okay. But obviously, you know, being a lay person, you probably don't know the difference, and that's why it's so important to get it checked, okay. So if you notice any form of lump, or if you are worried at all, always tell patient, you know, it's better to look silly, you know, and the doctor to tell you, sorry, there was nothing wrong, than, you know, to present very late and then there's nothing that we can do about it. All right, so please go and get it checked. Also, now get into the habit of actually examining yourself, okay. So when you're in your shower, just look around as you're washing yourself, and then you know what is normal for you, okay. The other thing is any form of lump, okay. So when we say any form of lump, you can have swollen glands. Commonly, people notice lumps around the neck, either the back or the front area, but you might notice lumps in your armpit. Actually, you know, the whole body is full of lumps. But what we call, they are glands. With our glands, they are lymph nodes, because one of the ways your body fights infection is through the lymphatic system, okay. So normally when we don't have an infection in the body, actually we are not aware of this. But often when we have infection, commonly people, when you have like a chest infection, you notice your glands here is the first one that comes up, it shoots up, okay. But the common areas is the neck area, lumps here, okay. So these are places you can feel lumps as well around your neck area here, just above your collarbone. If you see lumps in your armpit that is not going away, lumps in your groin, those tend to be the big areas, okay, that you might notice lumps that are not are sinister, okay. So most lumps are thankfully harmless, okay, and most lumps will go away. All right, but if something persists beyond 3 to 4 weeks, you know, get it checked. Like I said, it wouldn't necessarily mean that you have cancer, but it's good to see the doctor about it. The doctor might initially do some blood tests just to make sure, because often, you know, cancers of the blood, you know, lymphomas, you might always pick it up. You might see some changes in the blood, not always, but you can, and then the doctor might also decide whether to do a scan of that lump just to make sure that there's nothing to worry about, okay. So please do make sure that you get it checked. The next symptom that we're dealing with, the 7th one, is hoarseness of voice, okay. Now, this is when your voice goes like husky. Now, most people think that's a sexy voice, okay, and yes, if it's only going to last, you know, for a couple of weeks or so because you had a cold, because most of us, when we have a cold, we end up losing our voice, and therefore we end up with that hoarseness of voice, but we sort of know it came in the context of that infection. And often when the cold settles, it might take another 2 weeks, 3 weeks sometimes, and then it goes away, okay. But this is sort of new hoarseness that cannot be explained. The other reason that we might feel hoarseness in our voice is maybe an allergy reaction, or if there's a problem with the vocal cords, particularly people that sing a lot. And there was a time that I personally went through that, because I was singing a lot, I was teaching children, and I was always having a sore throat, and my voice was always changing intermittently, and actually went on for like a whole year, and I actually had to see a specialist. And it happened, you know, it was because of what I was doing, all right. So thankfully it wasn't something to worry about, but the majority of us is not always because there's cancer, so often you can explain it. However, if you notice that you know, your voice all of a sudden has changed, okay, and it's not because you had a chest infection or cold recently, or like a viral sore throat or anything like that, then please do get it checked, because it could be the first sign of throat cancer, all right. So usually if it has hoarseness of voice longer than 3 weeks and it's not settling, do see a doctor to at least reassure you, or whether tests are needed, okay. The next symptom that you should be aware of is blood in the urine, yeah. Blood in the urine often commonly can be because of infection. All right, when we have an infection, we do get that. We might notice blood in the urine, but also with that, you might notice that you're going a lot more often. There's pain when you pass urine, or burning or stinging when you pass urine. You might feel a bit of pain either at the lower part of your tummy, or you might feel a bit of pain in the kidney area, which is usually at the back here. You know, but sometimes you might not. All you might have to go on is a bit of pain and a bit of blood in your urine. Okay, so that might be infection. Also, it might be stones, kidney stone. So sometimes when you're passing a kidney stone, that might cause there to be blood in the urine. But often, you know, you have pain, like really bad pain, because the stone is passing. Okay, but you might not. So you still, if you notice any blood in your urine, don't assume. You need to get it checked. Okay, the doctor, you know, at best might do a urine test in front of you just to see whether there's an infection. If there's no reason, you know, he might want to repeat it maybe a week's time, or refer you. If you have frank hematuria, what we say frank hematuria means when I see blood in your urine, it's just your urine is just looking blood, you know, just red. All right, it's just all blood I can see. Often we need to refer you urgently, okay, to be investigated. And it could be infection of your, actually it could be cancer of the kidney or cancer of the bladder commonly, okay? So please don't ignore it. So any episode of blood in your urine, get it checked, okay? Now going along with urine stuff, if you notice changes in your urine, like I said, when you have an infection, because infection comes, you know, it's an acute thing. It comes, you know, over a period of hours and days, you know, you get treated and you are back to normal, all right? But if you have like a change in your urine, so frequent urination, you just find that you're going to pee a lot all the time, and when you go, it's only, you're passing only small amounts. Often men might get a bit of dribbling, so they find that, you know, usually when you go to pee, you should have a nice stream of flow of urine. But you know, sometimes when you have that change, you notice that when you go, it's like you haven't really emptied properly, and there's a bit of dribbling at the end of your urine stream. Or if you notice any change at all, you feel any sort of irritability or even any pain around that area that you shouldn't, okay, please do get a check. And I know men, you're not very good at going to see your doctors, okay? But please don't ignore symptoms. It's better to go and see someone and be reassured than ignore it. Now, why might this happen? Like I said before, it could be because of infection. Naturally, men, as you are aging, okay, there is normal enlargement of your prostate gland, okay? So your prostate is just like the size of a walnut that sits at the base of your bladder, okay? And basically, it's just surrounding that small tube, okay, that your urine passes through when it leaves the bladder. Now, as you are aging, that gland, prostate, can enlarge. It's a normal enlargement, okay? It doesn't always mean cancer. So it would enlarge, and that means that it sort of squeezes a bit on that tube, all right? And that's why you might notice some of your symptoms. But if you don't go and see a doctor about it, you won't know. But also, it could be a sign of prostate cancer, all right? Now, there's a lot of debate about whether you should test for prostate cancer or not, because it's one of those cancers that most people don't die too early from. Actually, when people are diagnosed with prostate cancer, they are more likely probably to die by a car accident than prostate cancer. In a small proportion of people, you have what we call the rapid or sort of cancer that progresses very rapidly, okay? So those are the kind of people that you really want to catch with prostate cancer. But the large proportion of people have the slow growing type of cancer. And therefore, they can even live 20 more years after being diagnosed. So some people think, is there any point in actually getting it checked? So often, we wouldn't say, you know, go and have a prostate check all the time. But if you notice symptoms particularly, yeah, then don't ignore it. Do go and get it checked. However, if you notice any symptoms, do see your doctor, because you might need further investigation. There is a blood test of a chemical we can check regarding the prostate. It's not very specific, okay, because it can be affected by other things like an infection, or even if you've had sexual intercourse, you know, a few days before the test, it can be affected. And if there's inflammation around the prostate, it can be affected. So, and it doesn't always, a positive test doesn't always mean that, you know, you have cancer. So often the main way to diagnose really is to do a biopsy, which is to take a sample from the prostate to do it. So, you know, often we will have an honest discussion about the pros and cons of of any investigation. But if you do have symptoms, then please do see your doctor and they can discuss further with you about it. Okay. The last symptom for today is swallowing difficulty or indigestion. Yeah, swallowing difficulty and indigestion. So naturally, when we eat, food just we chew it, moves through our mouth, and then down our gullet, enters our stomach. All right. There shouldn't be any problems. So if there's a blockage of any kind in the gullet, that can cause swallowing difficulty. So that could be to solids, could be to liquids. Okay. So if you notice that, then definitely it means that there's something blocking your gullet, and you need to know what it is. So you need to get it checked, because it could be a sign of esophageal cancer. Also, any new onset indigestion. So, some of us, we know when we eat too much of spicy food, or we eat fatty meals, or we eat too late at night, we might notice a bit of indigestion or heartburn. But if this is new for you, particularly for people over the age of 50, that could be a red flag, okay, of cancer. So therefore, you need to have it looked at. So I hope today's session has been very useful for you. We have a whole list of other red flags that we're going to look at in part 2 of this talk, cancer red flags. So I hope you tune in. Please don't forget to like on the Facebook page, make your comments, and also from this channel you can feel free to subscribe, so that you will have access to other useful videos. There's a whole lot of them there, which you'll find helpful. So until then, from Dr. Ario and the Health Talk team, bye-bye.